Hi, I'm Kayla Zadanis, and I'm going to be talking about the Biering-Sorensen test. Just to give you an overview, I'm going to give a brief background on the test. I'll talk about why we would want to use this test and on what kind of patients. I will explain how to perform the test along with variations of it, and then show a video demonstration. I will talk about the testing norms according to the research, and I will also give you options for other tests used. I will describe sensitivity, specificity, predictive value, and reliability. And finally, you'll have time to try it out for yourselves. The Biering-Sorensen test was first described by Hansen in 1964, who developed the test for evaluating the isometric endurance of trunk extensor muscle. It became known as the Sorensen test following a study by Biering-Sorensen in 1984. He used the test in over 900 individuals and concluded that a shorter position holding time during the Sorensen test predicted low back pain within the next year in males. Just to emphasize what I just said, the Sorensen test is by far the most widely used and studied test for assessing trunk extensor muscles. Good isometric endurance may prevent first-time low back pain occurrence. The Sorensen test assesses the upper back extensor and flexor endurance, or the thoracic region, rather than the lumbar region, as some of the other tests I'll talk about later do. Here's a video demonstration performing the Sorensen test. The patient is asked to lie prone on the treatment table, and then I'm going to ask her to put the upper edges of her iliac crest to the edge of the table. We'll make sure, and you're good. So now I'm going to take 3 straps and put one on her calves, one on her thighs, and one on her glutes. The test is started with the patient holding on to a chair or a stool, whatever is available. And she is then asked to fold her arms across her chest and then lift up off the chair and maintain a horizontal position for as long as possible. The test has also been performed on a Roman chair and sometimes with 45 degrees of hip flexion with various arm positions such as hands behind the head. In the video, I told the patient to hold the test position for as long as she could. In a real situation, I would time how long she was able to hold it. I would stop the time if there was a trunk downsloping by more than 5 to 10 degrees. But what do the times mean? According to the research, patients who experience no difficulty in holding the position, the test is stopped after 240 seconds. Biering-Sorensen reported that a position holding time less than 176 seconds predicted low back pain during the next year in males, whereas a time greater than 198 seconds predicted absence of low back pain. In another study by Latimer et al., who tested 63 subjects with 23 of them having non-specific low back pain, found similar results, and I will talk about the study later. Some studies show that females can hold for significantly longer than males. The reason for this is unknown. Other tests used to test the endurance of trunk extensor muscles include prone isometric chest raise test, the prone double straight leg raise test, the supine isometric chest raise test, and the supine double straight leg test. An article by Arab et al. Looked at the sensitivity, specificity, and predictive value of the clinical trunk muscle endurance test and low back pain. They studied the 5 tests I discussed earlier, including the Biering-Sorensen test. The specificity of a diagnostic test simply indicates the test's ability to detect those patients who actually do not have low back pain or will not have low back pain within the next year. A test with a high specificity and a positive result is good for ruling in a presence of low back pain. As you can see in the chart, the specificity for men was 76, and for women it was 84.6. Both are relatively high. The sensitivity of a diagnostic test indicates the test's ability to detect those patients who actually have low back pain as indicated by the reference standard. Tests with high sensitivity are good for ruling out low back pain. Again, seen in the chart, the sensitivity for men was 92.3 and 84.3 for women, also very high. A positive predictive value is the likelihood that a patient with a positive test actually will have low back pain. The men showed 80.8 and the women 84.3. Negative predictive value estimates the likelihood the patient with a negative test will not have low back pain. And still seen in this chart, men had 90 and women had 84.5. Although the Sorensen test is the method frequently investigated and reported in the literature, its sensitivity and specificity was lower than that of some of the other tests seen in the chart, if you want to look specifically at the prone double straight leg raise. And this is just a line graph comparing the same tests that were in the table before. The blue line is the Sorensen test. Published studies revealed that this test assesses the endurance of all the muscles involved in trunk extension, including not only the paraspinal muscles, but also the hip extensor muscles. This may be a reason why its sensitivity and specificity was lower than that of some of the other tests. Interclass correlation coefficient is a measure of the reliability of measurements or ratings. These results are back to the Latimer et al. Article I was talking about earlier. Each group had a high interclass correlation coefficient, which means that within each group, participants scored similarly. This demonstrates that the results are reliable. For instance, the current low back pain group had a mean holding time of 95 seconds, and so on. The high interclass correlation coefficient of 0.88 means that most participants in that group had a mean holding time close to the mean. To summarize, the Sorensen test was proven to be reliable and had a relatively high specificity and sensitivity. More research, however, needs to be done on females and why females can hold the test position longer than males, as well as the significance of the hip extensor muscles and endurance. In my opinion, it may not be the easiest test to perform in the clinic. It can be intimidating and patients may be scared of it. The prone double leg straight leg test proved to be more specific, sensitive, and valid, and is much simpler and not so intimidating.